Good evening, everyone, and thank you for joining us for this Medicare webinar series and tonight's topic, Medicare Eligibility and Coverage on Parts A and B, presented by the Pikes Peak Area Agency on Aging. We want to thank the Pikes Peak Library District for their partnership and support of this webinar series. Before we begin, we please ask that you mute your microphones until we reach the question and answer portions of the presentation. And now, to get things going, it is my pleasure to introduce to you our presenter, Roma Costanza, State Health Insurance Program Coordinator and Case Manager at the Pikes Peak Area Agency on Aging. Roma, it's all yours.
Thank you, Jared. So good evening, everyone. Thank you for joining us. We appreciate you taking the time out of your evening to join us tonight for this hopefully very informative presentation. As Jared mentioned, we are going to be doing our part one of a four-part Medicare 101 series. And tonight we're going to be covering Medicare eligibility and coverage for Medicare Parts A and B. And this will include enrollment and costs. During the presentation, I will pause to ask questions. If you have a question, you can either type it into the chat box at any time and I will address questions when I do pause, or when I pause at the end of each section, I will be willing to take questions. You can simply unmute and ask your question at that time. Hopefully everybody got the email that I sent out a couple hours ago that included the handouts for tonight's presentation, as well as a copy of the slides. And I will do that for each presentation through this four-part series. So I think that is all the housekeeping that I have, so we will go ahead and get started. So this is a presentation offered through the Pikes Peak Area Council of Governments Area Agency on Aging. And the mission of the Area Agency on Aging is to work with our 3 county communities to find systems and processes to allow people to stay in their homes and in the community for as long as possible. The 3 counties this agency serves is El Paso, Park, and Teller. This is also in partnership with our Pikes Peak Library District, who has been a wonderful partner for us for many, many years. So you may have found out about this presentation through the Pikes Peak Library District. If you have any questions or want more information, you can go to their website at ppld.org. And as Jared mentioned, I am with the SHIP program. I'm the coordinator for the local SHIP program, which stands for State Health Insurance Assistance Program. This is a federally funded program that's designed solely and specifically to provide information and education on all things Medicare. We do not sell or endorse any specific companies or insurances. We are true consumer advocates. The SHIP program out of the Area Agency on Aging actually covers a total of 9 counties in Colorado. I've listed the counties on the slide here. Every county in every state has access to a SHIP counselor or a SHIP program, usually at the very least by a statewide toll-free number. I've listed both our local Colorado Springs number as well as our statewide number on the slide. All right, so tonight we're going to talk about what is Medicare. Tonight, again, we're going to cover original Medicare Part A and Part B. Next week, we will cover Medicare Advantage plans and Medigap insurance. Week 3, we will cover prescription Medicare Part D, prescription drug coverage. And week 4, our final part in the series, we will talk about all other types of insurance that might be available to someone when they become eligible for Medicare, including Medicaid, Marketplace, employer, through active employer coverage, as well as retirement plans. But again, tonight we are going to focus on Medicare's Part A and B. And we're going to start with who runs Medicare. So there are 2 components here. Social Security is the entity that is actually in charge of determining who gets Medicare. So Social Security determines who is going to be eligible for Medicare based on paying taxes. So if you had employment through the private sector, and through that employment you paid employment taxes, some of those taxes went directly to Social Security and to Medicare. Social Security keeps track of those taxes and those wages earned to determine eligibility for Medicare when you become eligible at 65. Social Security is responsible for enrolling you in Medicare. No one else can enroll you in Medicare. It has to be done through Social Security. They also issue the initial Medicare card and or replacement Medicare cards. And Social Security can be reached by toll-free number, national toll-free number, Monday through Friday from 7 a.m. to 7 p.m. I've also listed our local Social Security Administrative Office here in Colorado Springs, as well as their phone number. Once you have Medicare, Social Security doesn't want anything to do with you. At that point, if you have any questions about your enrollment, about your benefits, your coverage, your costs, and your claims, you would have to direct those questions directly to Medicare or the Centers for Medicare and Medicaid Services, also known as CMS. Medicare, I'm just going to use the phrase Medicare to refer to them, is the entity that administers the program and benefits. They process any and all claims. They determine what benefits are going to be provided under Medicare Part A and B. They are the ones who pay Medicare providers for the services that they provide. Medicare is only available through toll-free number, nationwide toll-free number, but that availability is 24 hours a day, 7 days a week, 365 days a year. There is no brick and mortar location for Medicare. You can only reach them through toll-free number, or you can contact them through their website, medicare.gov, because they now have a chat feature where you can chat with a representative through that website.
Okay, Privacy Act. Okay.
So who can have Medicare? Well, Medicare is Medicare eligibility is for basically anybody who is a U.S. citizen, who is turning age 65 or older, and has contributed into the Social Security and Medicare tax system. You can also become eligible for Medicare if you have been determined to be disabled by Social Security by applying for disability. You can receive Medicare at any age if you are diagnosed with kidney failure and are receiving kidney dialysis, so diagnosed with ESRD. If you're diagnosed with Lou Gehrig's disease, also known as ALS, you can become eligible for Medicare at any time. And then any lawfully admitted resident alien who has resided in this country legally for at least 5 consecutive years is eligible to purchase Medicare.
You're muted. I understand. I'm supposed to be muted.
So when you first enroll in Medicare, or when should you enroll in Medicare? So these days, many more people are working past age 65 and are maintaining their full employer coverage, employment. So you don't have to be retired to enroll in Medicare, but you do need to be aware that there is an initial enrollment period that surrounds turning 65, whether you're working or not. That initial enrollment period is a 7-month window that starts 3 months prior to the month of your 65th birthday. It also includes the month of your 65th birthday and up to 3 months after the month of your 65th birthday. There are other opportunities to enroll outside of this initial enrollment period, the 7-month window, that we'll talk about here next. But the initial enrollment period that surrounds your 65th birthday is the most common opportunity for people to enroll in Medicare. And again, it starts 3 months prior to the month of your 65th birthday, includes the month of your birthday, and lasts up to 3 months after the month of your 65th birthday. That's called the initial enrollment period. Other opportunities to enroll in Medicare include a special enrollment period. The special enrollment period applies to one scenario. If you are actively employed and have insurance through that employment, and you choose to continue to be actively employed past age 65, you can actually delay enrollment into Medicare until you stop working. And at that point, you would fall under a special enrollment period, which would be an 8-month window from the time your employment ends to enroll in Medicare without penalty. If for some reason you don't enroll in Medicare during your initial enrollment period, you don't fall under a special enrollment period, you just decided at 65 you didn't need or want Medicare, you would still be able to enroll in Medicare any time down the road during the annual general election period. That general election period starts January 1st and runs through March 31st every year. And typically, and I apologize, I forgot to correct this slide, typically, if you are enrolling in the general election period, because that's your last opportunity, your coverage would start the first day of the following month. But you only get that January through March opportunity, and if you miss it, you would have to wait another year. If you are enrolling in the general election period, January through March, because you missed the other two opportunities, be aware that you could and probably will have to pay a slightly higher Part B premium based on late enrollment. And we will talk about that in more detail as we go. So this is what the Medicare card looks like. I refer to it usually as the red, white, and blue card. It will include your name. It will show when your Medicare Parts A and B go into effect. And it will include your Medicare ID number. The ID number used to be a Social Security number. In 2018, they changed that to be more secure and is now simply a 11-digit series of random numbers and letters that comprise your Medicare ID number now. This is the only information this card will ever indicate. It will never indicate any other parts of Medicare you may enroll in, such as Part D, or any other coverage you may choose to enroll in as well. Only your A and B will be indicated on this card. So there are a couple things you might want to do to make sure that you are able and ready to enroll in Medicare. And primarily, you want to make sure that your contact information is up to date at Social Security. If for some reason Social Security tries to mail you something in regards to your Medicare enrollment, and that contact information, that mailing address is not up to date, and they send that information to an address you don't live at, there is potential that someone could maybe get a hold of your Medicare card when it comes in the mail or something like that. So it's always a good idea, and it's always important to make sure that that information is updated at Social Security. And you can do that by either calling the toll-free national number for Social Security, or you can go to the Social Security website, ssa.gov, and create a personalized online account at that website. There are a lot of advantages to creating a personalized Social Security account. It's not required, but it is encouraged. In the email that I sent prior to this presentation, I did include a couple of handouts from Social Security that listed some of the things that you can do on the Social Security website, ssa.gov or socialsecurity.gov, as well as another handout that it explained how to create a personalized account or how to enroll in Medicare through the Social Security website. I also included a handout on how to create a personalized Medicare account. So these are going to be two separate accounts, one at medicare.gov and the other at socialsecurity.gov. The account you would create at socialsecurity.gov, of course, is going to be very secure because it's Social Security. And it will take a little bit more effort than it does to create a Medicare account. But I, again, included instructions on how to create a My Medicare account once you have a Medicare number. It only takes a few minutes. And again, there are a lot of benefits to having that account on the Medicare website, but it is not required. All right, any questions about any of that? Again, if you have a question, you can either type it into the chat or you can raise your hand and ask your question live. All right, I don't see any questions. I don't hear any questions, so we will move on. So now we are going to talk about the two parts of Medicare, and we are going to start with Medicare Part A. So things to take into consideration is how you may get Medicare. So be aware that if you are already collecting a Social Security income of any kind for any reason, whether it be early retirement income or disability income or anything like that, if you are already collecting an income when you become eligible for Medicare, Social Security will automatically enroll you in Medicare A and B. And they will automatically start deducting premiums from that income when A and B go into effect. But again, if you are still actively employed with health coverage through that employment, or you're the spouse of someone who is actively employed and are covered by their employer health coverage, you can actually delay enrollment into any part of Medicare until that employment ends, and then you would fall under that special enrollment period, which is that 8-month window to enroll in Medicare without penalty at that time. Other things to be aware of, is you have to basically earn Medicare. And you earn Medicare through, again, paying employment taxes. And that can be based on either your actual work history, or it can be based on a spouse's work history. But you would have to have accumulated at least 40 working quarters, is how Social Security defines that, which is the equivalent of 10 years of work history. That 10 years of work history can be accumulated at any point over the entire lifetime of your work history. So it does not have to be accumulated all at once. It can be accumulated throughout the entire work history that you may have, but you have to accumulate a total of 10 years of work history and paying into the tax system. If you can accumulate those 10 years of work history, you will be eligible to receive Medicare Part A benefits at no cost. If for some reason you do not have that amount of work history, you have less than those 10 years, you can still buy Medicare Part A, but it's not cheap. Medicare Part A for 2023 could be as high as $506 a month just for Part A. If you're not sure if you have enough work history paid into the Social Security system, the only way you can find out is contact Social Security, because again, they are the ones who keep track of that information. Or you can, again, go onto the Social Security website and create a personalized account, and that information will be available online through that account. So you can either earn Part A, again, through your own work history or through a spouse's, as long as you and that spouse have been married at least 10 years. Or if you don't have that work history, you can purchase Part A. So what does Part A cover? Medicare Part A is going to be primarily your inpatient medical services. For most of us, that will be inpatient hospitalization coverage. So if for any reason, while you're on Medicare, you are in need of staying as an inpatient in the hospital, Medicare Part A will cover all costs for that inpatient hospitalization, regardless of why you're there or how much it costs. Medicare Part A covers all costs except for a deductible. For 2023, the Part A inpatient hospital deductible is $1,600 per admission, not per year. So if you have multiple hospital stays in a given year, that deductible could be applied multiple times. But again, it's regardless of why you're there or how much that hospitalization would cost, how much it would retail for, basically. your max out of pocket would be $1,600. And that will cover you for up to 60 consecutive days stay as an inpatient in the hospital. Fortunately, being in the hospital for more than a week or so is becoming very, very rare. But if for some reason you were hospitalized, inpatient in the hospital for 60 days or longer, Medicare would continue to pay for that hospitalization, but starting at day 61, Medicare will start applying what's called a coinsurance, meaning Medicare will continue to pay for your hospital stay every day, everything except for $400 per day, starting at day 61. If for some unfortunate reason you're still in the hospital after 90 days, that coinsurance that Medicare pays everything except for goes up to $800 per day. Again, it would be a very rare scenario for anybody to be in the hospital for more than a week these days. But in a worst case scenario, that's what kind of cost you would be looking at under Medicare Part A. If you're in the hospital for longer than 90 days at a time, and again, this is a consecutive day stay, you would start going into your lifetime reserve days for coverage. So if you're in the hospital for longer than 90 days, you go into a 60-day lifetime reserve benefit, where you get an additional 60 days past 190. So say you're in the hospital for a total of 100 days, Medicare covers the first 90 under the regular benefit, and you would use 10 days out of your 60 lifetime reserve days. And then the other 50 of those days would still be held in reserve. Medicare pays up to that 90 days at a time, 90 consecutive days stay at a time, and that's defined as a benefit period. If you have had more than 60 days from the time you're discharged from a hospital before you're readmitted to a hospital, you would start a new benefit period when you're readmitted. If there is less than 60 days from discharge to readmission, you would be in the same benefit period that you started in. So be aware of that. And Medicare also covers inpatient psychiatric hospitalizations, but Medicare does put a lifetime maximum of 190 days for that kind of inpatient hospitalization. There is no maximum for how many days or how long Medicare will pay for inpatient medical hospitalization, but there is a 190 lifetime maximum of days that they will pay for psychiatric hospitalization. Things that are not covered under an inpatient hospitalization through Medicare are going to be private rooms, unless for some reason it's deemed medically necessary and ordered by a doctor. No part of Medicare will pay anything for the first 3 pints of blood someone might need to have replaced. Part A does not cover private duty nurses or room sitters. And Medicare Part A does not cover what's called self-administered drugs. Basically, self-administered drugs would only be a concern on, say, the day of discharge, because technically on the day of discharge, you're no longer considered inpatient. But if for some reason they're taking forever to discharge you, and in the meantime, it came time for you to take your maintenance medications, and they came to your room and said, here, it's time for your maintenance medications, and you took that cup of pills from them and swallowed it, then that would be considered a self-administered drug, and they could charge you privately for that. But while you're inpatient in the hospital, any and all services, drugs, surgeries, whatever, are covered under the Part A benefit. Medicare Part A also covers skilled nursing facilities or rehab facilities. In order for Medicare to pay for a skilled nursing facility, and most of us would fall into this service after a hospitalization for rehab or recovery. So in order for Medicare to pay for you to be in a skilled facility as an inpatient, you would have to meet the requirement of being in the hospital for at least 3 days as an inpatient before you were discharged into a skilled facility for rehab or recovery. If you've had that 3-day or longer hospitalization, and then you're discharged into a skilled facility for rehab or recovery. Medicare Part A will pay 100% for the first 20 days of that skilled facility stay. If for some reason you are in the skilled facility for rehab or recovery for longer than 20 consecutive days, Medicare will continue to pay for that facility stay, but again, they will start applying a daily coinsurance of $200 per day. And that will cover you up to the next 80 consecutive days stay. So Medicare basically will cover all or part of up to 100 days at a time in a skilled facility for rehab or recovery. That 100 days that they will cover all or part of is called a benefit period for that benefit. And you get an unlimited amount of 100-day benefit periods. But again, the first 20 days are covered at 100% of Medicare's benefit. And then starting at day 21 through day 100, Medicare pays everything except for $200 per day. If for some reason you are still in the skilled facility at day 101, meaning you have not gotten well enough to go home, even if it's to go home with continued care at home, in-home care. If you're still in that facility on day 101, Medicare no longer cares why you're in the facility because all benefits stop at day 101. And at that point, Medicare considers your continued stay in that skilled facility to be custodial. So Medicare pays all or part of up to 100 days at a time because they have determined in their infinite wisdom that if you have not gotten well enough to go home after 100 days, even if it's with additional care at home, then the likelihood of you going home is going to be pretty slim. And that's why at that point it's considered a long-term care or custodial care stay, and Medicare does not pay for long-term care or custodial care in a facility. And then the last primary benefits of Medicare Part A are going to be that in-home health care and the hospice benefit. Both of those benefits do require that a doctor certify someone's eligibility to receive those services. And if a doctor is able to certify that eligibility, then Medicare pays for any of the services covered under the home health care benefit or hospice care benefit at 100%. No deductibles. The only exception would be as if you receive durable medical equipment as part of your home health care services. So if you're provided with a walker or a wheelchair to use at home, that would actually fall under Medicare Part B, and Medicare Part B would pay 80% and you'd still have to pay the other 20. But all other services, including medications to make you comfortable and such, are covered at 100% under the Part A benefits. There are some limits that do apply, but not many. For the home health care benefit, it will only cover medically necessary care at home. So for example, if you are discharged from a rehab facility to home, it will pay for continued rehab, physical therapy. Or if you have a wound, it will pay for a nurse to come in and provide wound care, those kinds of things. It is not going to be something that's designed to just help you prepare meals or clean the house or things like that, because those are again going to be considered not medically necessary services, custodial care. But anything that's medically necessary and deemed and certified by a doctor as medically necessary, those benefits will cover. The hospice care benefit for Medicare Part A is specifically designed to allow someone to receive enough care to become comfortable at home at an end-of-life situation. So if you are determined to have basically 6 months of life expectancy left, the hospice benefit of Medicare Part A is going to provide you medications that will keep you comfortable. It will provide you nursing care. It'll provide you medical equipment. It'll provide you counseling, all at 100% coverage. What it does not pay for is room and board if you are receiving hospice benefits in a facility. All right, so I know that was kind of a short and sweet version of those benefits. I do see there are a couple of questions in the chat, so I will go ahead and address those. But if anybody else has any other questions, you can raise your hand. There's a little hand icon at the top of your screen, and I will unmute you after I'm done with these first questions. So I do have a question. Why does the calculator on the Social Security account not update the benefits monthly if you haven't taken your benefit yet? Okay, so what you've got to remember is Social Security is calculating benefits for the entire country, not just our state or just our region. It is, even though it's not really centralized, it's one entity calculating benefits for millions and millions of people. So those benefits are calculated on a scheduled basis. And they also have to account for people who may continue to work and are still paying taxes into the system. They have to account for recalculating benefits. To do it monthly would be very laborious, and quite honestly, they're so shortly funded and understaffed right now that it would be impossible for them to do that on a monthly basis. Probably not the answer you wanted, but that's kind of where it's at right now. Next question is, we will be doing a special enrollment period enrollment because the husband is still working and neither are collecting Social Security. Do you need to provide any proof of current insurance through employment? The answer is yes. So if you do delay enrollment into Medicare, again, you do not have to enroll in any part of Medicare if you continue to work. You do not have to inform Social Security that you are going to continue to work. If you are not collecting an income, because Social Security, if you don't tell them you want to enroll and you're not collecting an income, Social Security does nothing. They wait for you to contact them. So when the employment ends and you're ready to enroll in Medicare, you can enroll in Medicare anytime while you're still covered by active employer health insurance. And once that health insurance ends, because the employment ends, you have 8 months in addition to that to enroll in Medicare without penalty. When you go to enroll in Medicare, Medicare is going to require that a form be filled out. It's like a 1 or 2 page form that typically you take to the employer or human resources department. And that form is simply going to say that you had employer coverage from this date to this date. And that is going to be your proof that you fall under the special enrollment period so that you will not have a penalty applied to your premiums for Medicare. So it is a specific form. If the employer or HR department does not know what that form is, they can go to the Social Security website and just type in the search. Or if someone wants that form because if the employer no longer exists or is unwilling to fill that form out for you and send it in to Social Security, Social Security will accept that form to be filled out by the beneficiary, and then they'll follow up on it. So if anybody wants to email me after the presentation, I'm happy to forward a link to that form to you, and my contact information will be available at the end of the presentation. For anybody who may not have received the handouts, the email that I sent prior to the presentation that included the handouts for tonight's presentation, we will go ahead and, I see Jared responded to that one. We'll go ahead and get those materials sent out to you. And it looks like there were several people who didn't get those handouts, so I apologize, but we will get those out to you. Okay, I do have a hand raised, so I'll take one more question. Let's see. Let me see if I can unmute. So if you can unmute yourself, go ahead and ask your question, Kelly.
Can you hear me?
I can, go ahead.
Okay, I was just raising my hand because I did not get the handouts.
Okay, so if you can type that into the chat box, we'll make sure that we get that email sent to you.
All righty, thanks. So do I uncheck this right hand?
Yeah, just uncheck it. That's fine.
Okay, thanks.
Thank you. All right. Any other questions before you move on? Okay. So again, if you did not get the handout, feel free to type that into our chat box, and we'll make sure that gets out to you after the presentation. All right. So let's move on. So now we're going to talk about Medicare Part B. B as in boy. This is the other part of Medicare that's considered part of your original Medicare benefits. So things to take into consideration, again, if you are actively employed and covered by employer coverage, health insurance coverage through that employment by either yourself or a spouse, you can delay enrollment into Medicare until employment ends, and then have that up to 8-month window once the employment ends to enroll in Medicare without penalty. If you are collecting a Social Security income when you become eligible for Medicare for any reason at any age, then Social Security will automatically enroll you in Medicare Part A and B. If for some reason you don't want Medicare to enroll you in A and B, when you get that Medicare card in the mail, because that's what will happen, and that's how most people find out, is they just suddenly get a Medicare card in the mail, then you would simply take that card that you got in the mail, sign the back of it, and send it back. And Social Security will disenroll you from Medicare Part B. But once you're enrolled in Medicare Part A, you cannot disenroll from Part A. So as long as you're entitled to Medicare Part A at no cost because you have paid into the tax system, there's no downside to having Medicare Part A, even if you are still working, for example. But do be aware that you can only cancel Part B if you're automatically enrolled. So again, the biggest takeaway that I'm trying to get across to people is if you're actively employed with employer coverage through that employment, you can delay enrollment. You get that special enrollment window once that employment ends, or again, you can enroll anytime while you are actually still employed into Medicare without penalty. But also that if you're already collecting a Social Security benefit for income, you will automatically be enrolled by into Medicare by Social Security. There are some scenarios when you might need to have Medicare Part B. That would include if you are interested in buying coverage to go with Medicare, such as a Medigap policy or Medicare Advantage plan. If you are entitled to TRICARE because you are military retiree or the spouse of a military retiree. If you're not covered by employer insurance, TRICARE through the military does require that you enroll in Medicare when you become eligible, or you risk losing your TRICARE benefits altogether. But if you're actively employed or covered by employer coverage through a spouse, you can, again, delay enrollment into Medicare even by TRICARE. I also get a lot of questions from veterans who access the VA system for their health care. And the question is always, do I have to enroll in Medicare if I use the VA for everything? And the answer is probably. Medicare will only, or Social Security really, will only accept one excuse for not enrolling in Medicare when you become first eligible. And again, it's because you're actively employed and have health coverage through that employer. Any other scenario would create a situation where you could potentially be penalized if you enroll later. Again, Medicare is going to allow you to enroll anytime during their enrollment period or the general enrollment period. You're always going to be allowed to enroll in Medicare. But the longer you wait, if you delayed enrollment and you weren't actively employed, the more you're going to pay to have Medicare. So just because you use VA is not going to be considered a good enough excuse to delay enrollment if you decide you need to enroll or want to enroll in Medicare later. The bottom line is there's nothing that says you have to enroll in Medicare. It is optional. You are not required to enroll in any part of Medicare. But once you enroll in Medicare or want to enroll in Medicare, all of these rules and guidelines come into play. And again, I know I keep repeating myself, but I want to hammer it into people that the only excuse Social Security will accept for not enrolling in Medicare when you first become eligible is that active employment with employer health coverage. Special enrollment when that employment ends. And again, if you've missed both of those first two opportunities or didn't fall under those first two opportunities, you can enroll any year down the road during the general enrollment, January through March. Coverage starts the first of the next month. But if you miss that window, you have to wait a whole other year. The longer you wait to enroll in Medicare, the more you're going to pay for Medicare. So most of us will get Medicare Part A at no cost. Again, because you either have your own work history where you've paid into the tax system and have earned those 10 years of work history, or again, potentially through a spouse's work history of 10 years or more. But everybody has to pay a premium for Medicare Part B. For 2023, that monthly premium has actually gone down. It was $170.10 last year. For 2023, it's gone down to $164.90 a month. That premium is automatically deducted from any Social Security or railroad retirement income you may have or are already receiving. If you're not receiving a Social Security income and you go ahead and enroll in Medicare, because eligibility age for Medicare is 65, but if you want to wait for your full retirement age to enroll in Social Security, that full retirement age right now is 66 in, I think, 6 months. And the longer you wait, the older you have to be to reach full retirement age. So if you want to start Medicare at 65, but you want to wait for full retirement age to start collecting your income benefit, you would have to pay that Medicare premium directly to Social Security or Medicare. And you would do that either by them billing you quarterly on paper, or you could arrange that premium to be automatically deducted from a bank account every month through the Social Security website. If you incur a late enrollment penalty because you did not enroll at first eligibility, you did not enroll within 8 months of losing active employment, and that's why you delayed, or you simply just did not enroll when you became eligible. Medicare's penalty is calculated based on how long it took you to enroll after that. Medicare will impose a 10% penalty for every 12 full month period that goes by beyond your initial enrollment period. Every 12 full month period that goes by, they will add 10% penalty to that Part B premium. So if you wait 3 years, you're going to pay a 30% penalty. If you wait 7 years, you're going to pay a 70% penalty. And the way that is calculated is they will take whatever the Part B premium is the year you enroll. So say you're enrolling for the first time this year, 2023, but you were eligible 5 years ago. When you enroll this year, you're going to pay a 50% penalty. So they're going to multiply $164.90 by 50%. Whatever that comes out to is going to be tacked on top of the $164.90 every month forever. Once you incur a Part B penalty, that penalty never goes away. It is lifetime. And again, the longer you wait, the more it is. That penalty amount will always be the same for the rest of your life, but you should also be aware that the Medicare Part B premium does change every year. And honestly, I've been doing this for 23 years. This is the first year I've ever seen the premium go down. That premium tends to just increase each year. So keep that in mind and try not to incur a penalty if you can at all help it, because again, that premium penalty lasts forever. And then you should also be aware that now Medicare Part B premiums are called what's called means tested. And that is going to be based on annual income for beneficiaries. Basically, what that means is the more your income you make, the higher Part B premium you may have to pay based solely on income. And we'll talk about that in the next slide. So for Part B services, Medicare Part B does have its own deductible. Fortunately, the Part B deductible is annual, once a year, and this year it's only $226. A drop in the bucket compared to most deductibles these days. So that deductible is applied to whatever services you have first each calendar year. So if you are becoming eligible for Medicare and you enroll in Medicare, say in July, whatever services you have first under Medicare coverage will be applied to deductible starting in July. Once that deductible is met, Medicare will pay for most Part B services at an 80-20 split. Medicare pays 80%, leaves a 20% balance. And then come January, that deductible will be applied again because that deductible goes on a calendar year schedule. So after your initial enrollment year, that deductible is applied after January 1st every year thereafter. Again, the means tested premium based on higher incomes, also referred to as the IRMA, income related monthly adjusted amount, is based on income. Typically, it's going to be based on individual tax filing or joint tax filing. It is only applied if you have an annual income greater than $97,000 a year for a single person, $194,000 a year for a married couple. However, that is going to be what your income would have been in 2021, not what your income is today. The reason that is because Social Security is who is in charge of calculating who may have to pay this higher Part B premium based on income. And Social Security can only make that determination by accessing income tax records, IRS tax records, from the most complete, most current tax year. For most of us, that is going to be 2021 because we are just now starting to file taxes for 2022. So 2021 would be the most current tax year that could be complete. So they are going to look at that tax information from 2021 and look to see if you had an income based on that tax filing greater than $97,000 or $194,000. And if you did, you will have to pay a higher Part B premium. And you will receive notice of this from Social Security. There are 6 different tiers of income that you could have applied to your income. And again, the more you make, the more you pay. But also be aware that that is reviewed annually. So if in 2021 you may have had an income of $100,000 a year, but then you retired and now your income is $60,000 a year, you may have to pay a higher Part B premium for now. But when they go to review your 2022 taxes next year, and they see that you're not making that higher income anymore, that higher premium will go back down. So again, it's reviewed every year. It's not a permanent increase, especially if your income has decreased. But this is the income limits for that benefit or for that higher premium amount for 2023. Any questions about any of that so far? I know that was a lot, so I will go ahead and take a couple of questions I see here. First question is, retiring in June through PARA and eligible for Medicare in August. Do I get to enroll in May? Yeah, if you are turning 65 in August, you get 3 months prior to August. So July, June, May. So your initial enrollment period starts May 1st and ends 3 months after August. So September, October, November. So ends at the end of November. That is your 7-month window for initial enrollment. And then the next question is, can the means test premium be applied because income will drastically reduce the first year of retirement being due to retirement? Again, yes, Social Security reviews that IRS tax filing information every year. So just because you're imposed that higher IRMA premium the first year, if your income has reduced the next time they look at that tax filing, then the premium will also reduce. It's not a lifetime increase. It goes with the flow of your income. Any other questions? All right. So what does Medicare Part B cover? One more quick question. Is enrollment different than benefit eligible at 65? No. Well, enrollment is actually enrolling in Medicare, but anybody's eligible at 65. It's a matter of whether or not you take advantage of that eligibility and actually enroll. Hopefully that answers that question. So what does Medicare Part B cover? Basically, my rule of thumb for the difference between Part A and Part B is Medicare Part A covers inpatient services, Part B covers outpatient services. So Medicare Part B is going to cover any and all types of office visits or doctor's visits. It's going to cover all your x-ray and lab work, including PET scans and MRIs and all that kind of fun stuff. Covers all medical, surgical, and anesthesia services. Medicare does pay for medical second opinions. Covers blood replacement starting at pint number 4. Because again, no part of Medicare will pay for the first 3 pints of blood someone might need to have replaced, but Part B will cover blood starting at pint number 4. Covers your emergency ambulance transportation. Covers your annual vaccines, including the flu, hepatitis, pneumonia. Does cover the shingle shot, but Part B only pays for the administration of that shingle shot. Does not cover the drug itself because the drug itself would be covered under Part D as in drug. Covers all your outpatient physical, occupational, and speech therapies. Covers all your durable medical equipment, walkers, wheelchairs, oxygen, nebulizers, CPAPs, that kind of stuff. And then there's some limited coverage for additional services such as podiatry, optometry, chiropractic. Those services would have to have a medically necessary component for them to be covered by Medicare. So for example, if you go to an optometrist to see if your prescription has changed for your eyeglasses, that is not something Medicare will pay for. It's considered not medically necessary. But if you are developing glaucoma or cataracts, poke yourself in the eye with a pencil. Those would be medically necessary reasons to see an eye doctor, and Medicare would pay for that. Same kind of rule for, say, podiatry. Medicare will pay for a podiatrist if you are, if you have a heart condition or are diabetic or have some other medical reason that it's not safe for you to do your own foot care. Medicare will not pay for you simply to get your toenails clipped kind of thing without that medical necessity. Other things that Medicare does not pay for: routine physicals, routine foot care, as I mentioned, does not cover hearing aids or the fitting of them. Again, does not cover eye exams, the glasses related to eye exams, or refractions of the eye, even if the rest of the eye care service was medically necessary. Medicare currently does not cover dental in any way, shape, or form. It is on the table at the federal level, but it's not a benefit of actual Medicare right now. And Medicare will not pay for anything considered cosmetic or not medically necessary. The key to any Medicare coverage and for Medicare to pay for any benefit is medical necessity. There has to be medical necessity established by the doctor in order for Medicare to pay for anything. If the doctor cannot establish medical necessity for a service, then Medicare is not going to pay for that service. Now, having given you a list of things that Medicare does not cover, and most of them are going to be considered routine or not medically necessary, I can tell you that in exchange for that, Medicare now covers preventive services. And many of those routine services that Medicare used to not consider paying for are now categorized as preventive care. And Medicare, when preventive care became the big thing for medical insurance to pay for, Medicare jumped on that bandwagon. So a lot of services that Medicare used to never pay for are now covered at 100% because they're classified as preventive services. When you first become enrolled in Medicare, Medicare does cover a welcome to Medicare preventive visit, but this is not a physical. What it is an in-depth discussion with your medical provider that will look at your past health history, your medical history, your social history, your family history, and determine a baseline. And it will open the door for that doctor to suggest perhaps some preventive services that would be beneficial. This Welcome to Medicare Preventive benefit is a use it or lose it benefit right now. So you have up to 12 months to take advantage of this initial Welcome to Medicare Preventive visit from the time your Medicare goes into effect. Whether you take advantage of that benefit or not, you would still have access to an annual wellness review benefit. The annual wellness review benefit is going to be the same kind of thing. It's not a physical, but it is an in-depth conversation with your doctor about the previous year's medical history or social history, that kind of stuff. And it gives the doctor an opportunity to suggest potential preventive services that might be of benefit to you. Medicare is at the point where all preventive services are now paid for at 100%. And there is a extensive list of services that Medicare will pay for as a preventive benefit. The best way to find that complete comprehensive list is to get a Medicare and You handbook. The Medicare and You handbook is an annual publication that Medicare sends to all beneficiaries every year. And in that handbook, there's about a 30-page section that details what preventive services Medicare covers and what the criteria is to be eligible for those preventive services. And all preventive services listed in that section are symbolized with a little blue apple symbol next to that description of benefit. You can either go to the Medicare.gov website and look at the PDF version of the Medicare and You handbook, or you can call 1-800-MEDICARE and request one be mailed to you specific for Colorado. Or I actually got a shipment of 2023 handbooks this year for a change. There have been a few years I just didn't get anything I ordered, but I actually got several cases, and we're happy to provide those to you here locally if you want to come pick one up from our office. But that is going to be the best way to find a complete description of what preventive services are covered and under what criteria. All right, so that's part B in a nutshell. I'll take a couple more questions. We're almost done. So what medical services are covered? Again, I'm going to refer you to the Medicare and You handbook. Is diabetes covered eye exams count? Yes, because you have a medical diagnosis of diabetes and there are eye-related complications that could pertain to that. As long as the doctor tells Medicare that that was a medically necessary eye visit based on the diabetes diagnosis, that would be covered by Medicare. And then I see Jared has replied to our where's our office question, so we're good there. We are located just downtown, just west of I-25 off Colorado Avenue at Chestnut. And you're welcome to walk in and ask for a Medicare and You handbook, but we do request that you make an appointment if you want to sit down and talk to one of our Medicare counselors. All right, so to wrap it up, we're going to talk about some financial assistance programs that are available to people who are enrolling in Medicare or are enrolled in Medicare who may have limited or low income. Primary program that we're going to talk about tonight is called Medicare Savings Program. Medicare Savings Program is specifically designed to help cover the cost of your Medicare Part B premium. And if you qualify for this program and apply and are approved, what that means is the Medicare Part B premium would not be deducted from your Social Security income, or you would not be required to pay for it. The state of Colorado would pay that premium for you. If your income is within the thresholds, you may also qualify for the state to pay your Medicare deductibles and any other balance that Medicare A or B left over after they paid for service first. If you apply for and are approved for Medicare savings programs, you would also automatically get financial assistance applied to drug coverage through Medicare Part D. But again, you do have to apply for and be approved for that assistance program. And typically to apply for that program, you do have to do an application at the Department of Human Services. If you are already enrolled in some programs, such as supplemental security income or a state program called OAP, or if you are receiving long-term care Medicaid through the state, you would automatically become eligible and enrolled in this assistance, in addition to the benefits you're already receiving. But because this is a financial assistance program, there are income and asset requirements that you would have to fall within. And those requirements, those requirements are listed. The numbers for 2023 just came out. So if your income falls at or below $1,660 per month for a single person, and that would be pre-deduction income. That would be any income before taxes or insurance premiums or anything else was deducted from it, gross income per month. If it's at $1,660 or less, and you have liquidatable assets, checking, savings, investments, property you don't live on, money market, that kind of stuff. If you have assets of less than $9,090, and we could add $1,500 if you have a burial arrangement to that total. If your assets fall below that, then you could qualify for the state to pay that Part B premium so that it is not deducted from your income. The income and asset limits do increase every year with the cost of living. Again, the asset level can be, you can add $1,500 per person if you have a burial arrangement of some sort. And it does not look at your home that you live in. It does not look at your primary vehicle. It does not look at your personal possessions, but it will look at any liquidatable resource or asset that you have, such as bank accounts or investments or property that you don't live on. We do assist with these applications at our office as part of our service. So we're happy to talk to anybody who might have questions about these programs or might want assistance applying for these programs. We're happy to talk to you and help you out with that. And that's about all I've got for you tonight. Any other questions before we wrap it up? I still see in the chat we're getting the address and our hours. We are always available to answer questions over the phone. I've listed on this slide our statewide toll-free number. Again, we cover 9 counties in Colorado out of our Colorado Springs office. And again, this is part of the SHIP program, the State Health Insurance Assistance Program. This is a federally funded program available nationwide. If you're interested in more information about what this program does and what it's all about, please go to the shiptacenter.org and it will provide you some good information about this program and how to access it from anywhere in the country. Also, during one of these weeks of our 4-part series, we will include in our follow-up email a survey that goes directly to Medicare regarding our presentations. And it is, so this is a national survey that is being conducted by Medicare and the Administration for Community Living. And we appreciate anybody who takes a few minutes to complete the survey. because it definitely does help continue the funding stream for this program on a federal level. This program is also responsible for a sister program called Senior Medicare Patrol. The Senior Medicare Patrol program is actually dedicated to education and information and assistance regarding Medicare or Medicaid related fraud or abuse. So we provide educational presentations. We can help people when they have claims, concerns, or issues, or if you think you have been defrauded by someone who has tried to scam you in some form or fashion. You are always welcome to contact us, and we can help you resolve those concerns, or at the very least report it to the Office of the Inspector General, because all the fraud cases that we report do go up to the federal level. If you want more information about the SMP program, you can go to the smpresource.org website. And because this is a government-funded program, that means we don't get a lot of money, but we are also always interested in anybody who would be willing to volunteer or even get more information about volunteering. To provide education and assistance regarding Medicare or Medicare-related fraud can be one of the most fulfilling things that you ever do, most comprehensive things you ever learn. But it is complicated and it does require a lot of training. We are always happy to talk to people. There are different kinds of volunteer opportunities that are available, from the comprehensive to the very easy. So if anybody is interested in volunteer opportunities, please contact me at our office, and I'm happy to talk to you. And I think that is all I have for you tonight. So I will look to see if we've got any more questions. And I do see one more question. What is this difference between QMB and the 1660? So we're talking about the Medicare savings. So there are 3 different levels of Medicare savings assistance. And those 3 different levels are obviously based on income level and asset level. Well, the asset level is the same across the board, but the income level. So the QMB, which is the lowest income level that you can qualify for. So if your income is at $1,235 or less gross monthly income for a single person, QMB is what you would qualify for, and that is the level of assistance that would pay not only your Part B premium, but would also pay any Medicare deductibles and co-insurances that are left over after Medicare pays first. The SLMB and the QI1 program only covers the Part B premium, would not pay any medical expenses. And then last slide is my contact information. We currently have 5 full-time counselors and 2 part-time volunteers. So someone should always be able to assist you. Give us a call. If you have to leave a message, we will call you back as quickly as we can. We are happy to schedule in-office appointments at this time. We can also schedule online video appointments, or we can help you over the phone. So if you have any questions, you're also welcome to email me at seniorinsure@ppacg.org. Other than that, I think that's all I have for you tonight. Again, we really appreciate you joining us tonight. We hope to see you next week when we talk about Medigap and Medicare Advantage plans. And if you have any other questions or concerns in the meantime, don't hesitate to contact us.
All right. Thank you, Roma, and thank you all for attending tonight's Medicare webinar series. As Roma mentioned, our next series event will take place next Thursday evening at 5:30, and it'll cover the Medicare options with Medigap and Medicare Advantage plans. If you haven't already registered, you can do so by visiting ppacg.org/events. And as Roma mentioned, you'll be receiving a survey after this webinar this evening. We appreciate any feedback that you have and how we can improve this webinar. And this webinar will also be available on demand on our website in case you need to refer to anything. And as you see, Roma's contact information is right there. Please make sure to reach out if you have any individual one-on-one questions that Roma and her team might be able to answer. I saw a question, where do we all view this recording? It will be on our website, ppacg.org, most likely tomorrow afternoon. It will also be posted to YouTube.
And there will be a link to that in the email that we send out? Or
We won't, since we're sending out the email tonight for the survey, we won't be able to have that in there as well at that point.
but if you need it, just contact us, we'll give it to you.
Exactly, and you can reply back to the registration email, and we can get it back to you on that way in case you want that recording.
All right, again, thank you all. Have a good night. Enjoy the rest of your evening, and hopefully we'll see you next week.